This morning in the studio with me, I have a dental surgeon. That's it, a dental surgeon. Okay, in the person of Dr. Wemambu John.
Yeah.
I'll take my time to call that.
Better this time around.
Let's take my time to call out your name. He's the secretary in Nigerian Dental Association, Lagos Zone, and he's a maxillofacial surgeon. That's it.
Yeah, that's it.
Maxillofacial surgeon with Bagada General Hospital. In fact, I've been trying to pull this man here for the past 1 month.
You did a good job. You got me. I'm here finally.
Thank you so much. Thank you for being our guest. Talking about oral health. This is our mouth. Even at times when you decide to neglect the ear, you could have been having some pains in your ear. You just say, okay, I'll do it tomorrow, next tomorrow. Your eye, you might not be seeing well, and you still be straining your eye. I have a lot of people that will say, I don't want to use glasses. You'll still be managing. But when we talk about oral health, talking about dental health, if you do not take it, once you open your mouth, everybody knows. Tell us about how generally the layman out there can easily take care of take care of the dental health.
Okay, thank you very much. Let me start, like you were saying, well, most importantly, once there is pain in every part of the body, you just have to look for solution. Ear, eye, mouth, anywhere, because pain, when it comes, could be that depressing and devastating that you just have to look for a solution. Now, when we talk about oral health, I would just say it's the health of the teeth, the gum, and every area associated, where we call the orofacial region, which I would, for simplicity, say from the neck all the way up to the head. So this whole area encompasses the oral health region. Okay. And then you were saying how important it is, we need the mouth and our teeth for eating, for smiling, for speaking. In fact, when you come in contact with someone, the first thing just from saying hi, the first thing you want to notice is the person's teeth and the mouth. There's this picture that trended some time ago about a guy with a lost central tooth, and then the eyebrow was shaved, and the first thing everybody noticed, even for me, the first thing everybody noticed was the missing tooth before you even noticed that the eyebrow was shaved out. So when we talk about that, and that's why the dentist, we define the mouth as the window to the body. Now, the importance of the window to a house. It brings in ventilation, takes out foul odor and everything. That is how the mouth is to the body. So it's very, very important when we talk about oral health. We are talking about the general health. Because I tell people, when you talk about oral health, you can't talk about oral health or dental health in isolation. It's all linked. Lots and lots of systemic diseases, as in diseases and conditions that affect the general body, manifest in the mouth. Nature has done it that way, that these things can be picked out directly from the mouth. So there's no way I'm talking about general health and isolating dental health. So we talk about oral health, very, very important part of health. And then there are lots and lots of habits that people partake in that are injurious or very, very inimical to both the oral health and the dental health. Talk about even from childhood, when you talk about, you see children that suck their thumb or tongue. You see people that have pins, always putting pins and biting on pins, even not brushing properly or adequately, and even the types of toothbrushes and toothpaste you use. All this come together. Even some kind of food you eat. Some people like very, very hot food that scalds the gums and co. Yes, you take very hot things. You notice that when you take very, very hot things, after some time, you notice that your gum seems like it's abraded, that you feel sore around there. So lots and lots of habits that people go into that would affect the dental health, and by so doing have some effects on the general health. Because once pain comes, everything stops until you sort out that pain.
Okay, there's something I really want to talk about now. I like to talk about it when I have you with me, is mouth odor, because I know that it's something that affects a lot of even intellectuals, even people, elites. There are some big wigs there. You talk to them, you just
you move back.
Start.
Or you just brush around your nose. Yes.
Let's talk about mouth odor.
Okay. Now, mouth odor. Very, very important aspect of oral health. And like I said earlier, there are different causes for mouth odor. You need to isolate what is the cause for this mouth odor before you begin to seek solution to it. Now, but there's something, I had a patient some days back, and a major complaint was mouth odor, that she feels she has a bad breath. So after interacting with her, I had to counsel her. Because when we talk about mouth odor, there is this part that we say it's physiological. You find it in everybody, every one of us. Once we fast or we sleep and we wake up, that's a physiologic mouth odor. Your breath is not as fresh as it should be. So that's normal, it's physiologic. You take a sip of water, or you go brushing, or you eat something, it's off. But then we have those that are pathological, they are caused by, there is a causative agent for it. And amongst this, we talk about the food we eat. Some very, very strong scented food brings about mouth odor. The gingers and the garlic and co, they bring about that mouth odor. Then other than that, carious, as in cavities on teeth, because these cavities are caused by bacteria. Cavities on teeth forming holes, they cause mouth odor. Now, when you also have what we call accumulation of plaque. Now, you look at some people, you see their teeth, at the base of it, you find some of these yellowish, at times greenish. Those are what we call plaque. They are actually bacteria that has calcified. And because they've calcified, they are there, very visible in the teeth and adherently attaching to the teeth. Their odor, they cause bad breath, in the sense that they eat up the supporting tissues of those teeth they are attached to, causing a problem there, and then it manifests as mouth odor. Now, still talking about mouth odor, you have some people that it's actually a mental health problem. Yes, we have some that are like that. They actually don't have this mouth odor, but something just keeps telling them, I have a bad breath. Now, these ones, aside counseling, you refer to the mental health people, because it has to do with psychological prepping to get them out of it. So mouth odor is an encompassing field. And I tell people, you have diabetics who come in to the dentist, and the dentist notice, because there is a smell from them, we call it ketone smell, that you perceive, this person, and then you are able to refer this person to the endocrinologist. You have people that have liver issues that come into the dental clinic, and you detect from just that odor. So there are lots and lots of causes for mouth odor. Now, solving it depends on what is actually the cause of it and how to go about it. But we'll come back to the general one, which is caused by caries, cavities on teeth, bacteria that is not brushing adequately, and maybe the food you eat. So for these two, if you have these holes and cavities on your teeth, you go to a dentist, they clean out your teeth and fill it. It improves. Now, for the other one, maybe the food you take, you take strong scented food. All you need to do is, after taking this food, a rinse or a brush out helps improve it. And then, like we say, the general one that is caused by just poor oral hygiene, that one is done by, you visit your dentist, they do what we call scaling and polishing. They clean this bacteria out. Now, you cannot do it at home with your toothbrush, really, because these are like stones, calcific stones, stones that have calcified and attached it. So you can't do it by toothbrushing. It needs to be mechanically removed. Now, the irony is that for some of these, they are not just around the neck of the teeth where you see. Some of them are below the neck of the teeth, where we call subgingival. So you don't see it. You appear to just have, very good, you look at it, but I don't have this there. But they are in there. So until you visit a dentist who mechanically scoops them out, you wouldn't know.
Okay, tell me this morning now. I want to talk to the common Nigerian out there like me. What are the basic things to do to keep good oral health?
Well, it's simple.
And things to keep away from.
Okay, it's simple, pretty simple. You ask yourself, what and what?
For someone like me, I just wash my teeth. That's all. Wash my teeth in the morning and wash my teeth at night. That's all.
Okay, you are halfway there. You should visit your dentist at least as regularly as possible.
I don't think I do, except when I have to go and I have an artificial tooth. So when I have issues with that artificial tooth. So I should, whether I have problem or not.
Yes, you should.
Just like the medical checkup.
Yes. When you say you're going for a medical checkup, your medical checkup is not complete without a dental checkup. Like I said earlier, some of these conditions are actually detected first from the mouth and the teeth. I've had cases to send people to go and do some tests, some viral tests, retroviral tests, because I saw something on their gum.
Ooh.
I didn't have to tell them, but I said, you know what, I would recommend you just go and do this test. And they come and say, oh, how did you? I said, don't worry, we see these things. So there are lots of conditions that are first noticed. And then, with health generally, the earlier it is detected, the higher the chances that it will be resolved, the better for you. And so if the mouth is the window to the body, it just falls into place that you shouldn't just take care of your general health. Your dental health should also be paramount. So like I said, pretty simple. You watch the things you eat. You watch when you eat them. Now it's very important, the when part of it is very important to prevent caries. Yes, the when part of what you eat. Now for some of us sweet tooths out there, biscuits, chocolates. All sorts of candies and all sorts. Even some of us that like rice and plantain, dodo, ripe one, fried, fried plantain. So we eat them because we cannot stop you from eating food. But what we can do is to moderate how you eat them so they don't get your teeth or your dental health into trouble. And what are we saying? Most times, if you are not able to brush, ideally you finish eating most food, you rinse out.
Okay.
Not all of us do that.
We don't.
Now,
so we should
ideally,
okay,
yes,
we should
because you have this food residue.
But can we just rinse and swallow?
When you rinse, because what you're actually rinsing out.
I can rinse and swallow it.
Yeah, you can rinse out, but what they actually are the residues and others in the mouth. Okay. So it's just the same way that people pick their teeth. Oh. So do you pick your teeth and then you swallow what you picked out? Yeah. So that's not just it. So it's all these residues. So ideally, you finish eating, you rinse out. Okay. If you cannot do that, then you watch the time you eat them. Okay. What happens is when you eat, especially you take all these candies, we call them in-between meal snacks, especially the kids are going back to school. Some have even resumed, some are going back. You pack all sorts of biscuits, candies, chocolates for them. We always advise that you let the teachers know that much as they are snacks they take, but they take these snacks very close to meal times. Not that they finish a meal, maybe an hour or two later they take the snacks, then before they take another meal, some 3-4 hours. No, they take it just, if you know they're going to take a meal in like 30, 15, 20 minutes, you give them the snacks.
They won't eat again.
No, what this does is, when they take those snacks, the residue that are not easily cleansed out, the chewing action, the masticatory action of the teeth actually gets them out. So if you are not rinsing immediately after, then the chewing action of that food gets those residues out and keeps the teeth surface clean. Because as you chew, it does that. So we say you eat just towards meal time, not far away from it. Then other things, like I said, you visit your dentist regularly. Then for the tailors and the seamstresses around, amongst us.
I wanted you to go there.
For the seamstresses and the tailors around, that maybe the stress of the work, and you always have them, they put pin in between their teeth, and even without putting pin, even for us that are not seamstresses and tailors, you have toothpick permanently in your teeth. If you notice over time, if you've done that, you notice over time, you find out that you begin to have spaces in between the teeth, because that continuously puts pressure on the support tissues of the teeth, and then the teeth just gradually moves. And once it starts moving, you begin to have spaces. That means your support structures of that teeth is already compromised. You see, so lots of things, but basically, visit your dentist as often as possible. We say twice a year, but the government and the HMOs have tried to make things easier for us. You have an HMO, or you have, and I know most private clinics, or you walk into any clinic, government or private, once you are registered, I don't think you pay consultation each time you come. It is only when a procedure is done. Even in government hospitals. Yes. So you go, you register, you come in routinely. I just came for routine checkup, and these things are checked. Then, of course, the food you eat, like I said, the timing, everything all encompassing helps to just give you that good dental health.
Okay, I think I just have to let you go. I know you have a lot of things to talk about, but finally, before I let you go, I will not let you go without asking you this particular one. You know, online sources will say that brushing your teeth, after brushing your teeth, that you shouldn't rinse. How true is that? Why?
Okay, now let's look at this. Is
that true? Yes or no first?
That's why I want to explain the logic behind that.
Okay, quickly, because we have to go.
Okay, now the logic behind that is, in Nigeria, our water, you know, there's this element we call fluoride that helps to protect the tooth because it helps it remineralize. In most, ideally, you have fluoridated waters. But because our waters in Nigeria are not fluoridated, the only means of fluoride we get is toothpaste and then some fruits. So, and that's the logic behind leave the toothpaste, leave the on your mouth so that the fluoride would work, you know, do its action. That's the logic behind it, because they want the fluoride, the action of the fluoride on that teeth. But for me, you brush, you rinse out.
So what would you advise the fluoride now? We need fluoride, because most times when they advertise all of these toothpaste rather, they say whatever fluoride, they contain fluoride.
Yes,
which means that fluoride is very, very important.
No, very important for the teeth. If you use a fluoride-containing toothpaste and you brush regularly, you don't need to begin to aspirate everything you brush out, because even when you brush, at times you brush out those plaque calculus, you don't need to aspirate them.
Thank you so much. All right, thank you so much. I know that you are a maxillofacial surgeon. I really wanted to go into that surgical aspect, but my time is fast spent this morning. I hope you will come back when, I don't worry, I'll give you like 1 week notice. We really need to talk about the surgical aspect, and we need to talk about
the cancers, the tumors,
and everything. People need education, please. So we still have to call you back to this table.
Anytime.
Thank you so much. I have been talking to Dr. Wemambu John. He is the Secretary, Nigerian Dental Association, Lagos Zone, and a maxillofacial surgeon. Thank you for being my guest this morning.
Thank you very much.
Yes, this is where I draw the curtain this morning. I'm calling it a wrap right now on this segment, because in no time, I'm going to hand you over to Stanley Paul Ikao to bring you the stories from the sporting world. Bumper Breakfast continues tomorrow. My name is Yinka Kenny. Bye-bye from me for now.